We live in a world where cardiovascular disease of the heart and arteries is our country's greatest killer, a disease affecting countless millions and costing our nation billions, with numbers that inexorably rise, with this WHO declared pandemic. An unfair disease targeting our most vulnerable. People of disability or different ethnicities remain invisible. Women not taken seriously are half as likely to receive much needed treatment, with death rates double of what would be parity. Time-poor clinicians fail to communicate to traumatized patients full of fear, frustration and anxiety the severity of their complex interventions. As health illiteracy, the public's average reading age, makes their scientific terms incomprehensible. An 8-minute sprint to explain all that is needed in your new regime cannot be processed. But patient discharge is the name of the game, and the clock is ticking. But what of the consequences? We see staggeringly high deaths and readmission rates that remain the leading cause of medical litigation. And now COVID-19 mercilessly has had its own impact, with chronic patients left to fend for themselves or too afraid to get desperately needed aid as pandemics join forces, setting us on a far more hopeless trajectory. How do we help people who do not understand the basics, who feel they're asking stupid questions, that we give them the time and the space they need to be there when there is indecision? How do we help people not fall off a cliff when discharged, to learn new skills and behaviors, to manage their health, their medication, to live healthy lives, to have the patience of a saint, build trust and rapport, and change the rules of the game? Imagine a world where you had your own personal coach, one that understood the health domain, that spoke like you, that understood your culture's intricacies, and could answer common questions, that tirelessly dealt with repetition to help you make more informed decisions. Your digital coach, focused on cardiovascular disease, backed by a corpus of knowledge, machine learning trained with tens of thousands of questions, co-designed with a lived experience that spoke to you and I like a human. Imagine a world that overcame these barriers, where through prevention and understanding, we reduce death rates and destruction, where we help people not just survive, but live and thrive. Imagine a world where the cardiac coach is but the first of many, where we build open source ecosystems and new industries that champion holistic well-being. Imagine a cardiac coach that helps those facing their own mortality, helps alleviate this sense of fear and abandonment, that gives back some control, some independence and dignity, and helps them face head-on their own personal adversity.